Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight, as some of you may be wrapping up dry January, a new Health Canada funded report recommends Canadians limit their alcohol consumption to 2 drinks per week, as anything more puts your health at risk. These updated guidelines from the Canadian Centre on Substance Use and Addiction are a dramatic change from only 10 years ago, when we were told that women could enjoy 10 drinks per week and men could enjoy 15. Will this news make you reconsider your relationship with alcohol? And is there any chance that these recommendations are a bit of overkill? Joining us to examine these new guidelines is researcher, public health physician, and Vancouver Coastal Health medical health officer, Dr. Michael Schwandt. Dr. Schwandt, so nice to see you. Thanks for being here tonight.
Thanks for having me, Mo.
So these recommendations come out, and I feel like people were really caught off guard. Canadians were wondering, how could we go from the original recommendations from maybe 10 years ago for 10 to 15 drinks per week down to 2 drinks per week? Like, what have we learned about alcohol consumption that has resulted in this dramatic change in what we should be consuming in terms of alcohol?
Well, that's right. Canada's guidelines on alcohol and health are out this month, and it is a major update from the previous low-risk drinking guidelines, as they were called. Those came out in 2011, so 12 years ago, and really had a threshold-focused approach, as you mentioned, to how much alcohol can be consumed with low risk. The new approach really is more about a continuum and understanding that the risk of cancers, heart disease, and other health impacts can go up, even with fairly low levels of alcohol consumption that might be quite a bit lower than was previously understood. So it is a major change. A lot of science has gone into this, and it does have some implications for health.
One of the criticisms in terms of the backlash that I've seen is this idea of relative health risks versus absolute health risk. And so what I mean by this is that, let's say a non-drinker is at risk for a certain disease, and that risk is 1 in 10,000. And a moderate drinker would then be at risk for that same disease 2 in 10,000. Right. So the relative risk goes up by 100%. It doubles, right? But the absolute risk, it is kind of negligible because you're talking about 1 in 10,000 versus 2 in 10,000. So what's your response to people who say, you know what, the actual risk to yourself if you have a glass of wine or a beer every night actually doesn't make that much of a difference?
Well, it's a great point, but some of these health conditions are not so rare. So while we might not be as concerned about some of these health issues out there that aren't so common, many of them are. So things like these cancers that we're looking at, the impact of alcohol, heart disease, and so forth, actually do have a fairly major probability of occurring. So if you think of something like breast cancer that might affect something like 1 in 10 women in Canada, if you're increasing the risk of that, even by small amounts, that's really quite a significant thing. So there's some of these conditions are quite common and get even more likely with increasing alcohol consumption.
When you talk to just regular folks about the health risks involved with alcohol consumption, what are some of the biggest things that people just don't understand or don't know about when it comes to, having that glass of wine every night or having that beer every night?
One of the things we find in public health and also that's out there in the research is that while people have a good understanding of some of these acute risks, so things like motor vehicle crashes or some of these injuries, some of the things that can happen immediately during binge drinking, some of the longer term risks, especially around cancers, just aren't well known to people. There's some data that suggests only about 1 in 4 people are well aware of the association between cancer and alcohol. And that's something that when you look at, for example, tobacco smoke and cancer, we have much better understanding as a society. So that's one area where I think that we have a lot to do to help to empower people, inform people, make sure there's transparency around what the science says.
Are we able to classify alcohol as a carcinogenic? Like, it's cancer causing?
Yeah, absolutely. It is a class 1 carcinogen, which sounds scary.
It does.
And it does. That puts it in the same class as tobacco smoke, meaning that there's excellent evidence, as the experts say, around the causal connection between the substance and cancer risk, both in human evidence, so in clinical or epidemiological studies, also in terms of lab data that explains that connection. So yes, it is a very serious cancer-causing agent.
One of the issues I'm having with this is that in our culture, in our society, I feel like for the longest time we've been told that having a glass of wine every night is good for you because of antioxidants. I've even heard that having a beer every day is good for you because it has a lot of vitamin B in it. So Are there any health benefits to having a drink every day or every night?
Yeah, these new guidelines haven't looked as closely at some of the ways that alcohol might be linked to social connection or to issues like that. They've mostly looked at the potential harms that are there. But around those harms, like alcohol, heart disease, some of those others that I've named, really there doesn't seem to be a safe amount. Some of the previous studies that found a very low amount of alcohol could be protective actually seem to be due to what we'd call confounding factors. So other characteristics of people who have that low but consistent alcohol consumption as compared to people who completely abstain from alcohol.
So what do you mean by that?
Well, one of the examples would be that sometimes when these studies compare people who have one drink a day to people who have none at all, the people who are having none at all in these studies might not be drinking because they've had previous problems with alcohol, because they have health conditions like heart disease, and thus they're abstaining deliberately. So as more and more studies have tried to dig into these issues to closely control for those factors, and also looking at things like socioeconomic status that might be in fact associated with moderate low amounts of consumption, at the end of the day in the wash, it seems that as we increase alcohol use, we do increase these health harms, and that there isn't a protective amount as was previously described in some studies.
Interesting. So one of the recommendations in this report talks about health warning labels. And I feel like a lot of people are quite upset about this, even though, again, it's just a label, and we know that alcohol is a toxin. Do these health labels, if we were to put a warning label on a bottle of beer or a bottle of wine, are they actually effective?
There is some evidence that they are. So we have some countries globally that are implementing this. If you go to Australia and pick up a bottle of wine, you're going to see right on it the number of units of alcohol, standard drinks as they're called. And it's very important, I think, that this is communicated to people. I think that it's a matter of transparency, that people understand what they're consuming. If you and I go for a beer or have a large glass of wine, we might be, in fact, having 2 or 3 standard drinks of alcohol in terms of the way that the alcohol is studied and the way that these communications come out.
Because a 6-ounce glass of wine is not a standard glass of wine. It's not the way it's measured, right?
Well, exactly. The standard unit is tied to the amount of alcohol that would be in a 12-ounce bottle or can of a normal beer at 5%, 6-ounce glass of wine at 12%, or 1.5 ounces of liquor, 40%. Okay. So when you think of a full pint of a stronger beer than that, for example, or a 9-ounce pour of a wine that might be stronger than that, or cocktails that can have 3 ounces or more, you're quickly escalating into more and more standard drinks, not always with a clear pattern. You have to do a little bit of arithmetic to figure out how many standard drinks are in there. You and I aren't going to do that, and people shouldn't have to. This is something that should be transparently communicated if we're going to make sure that people are aware of what they're actually consuming, as we do for many other products.
And I think this gets to the heart of the matter. What we're talking about is providing people with information as opposed to mandating, any restrictions or anything like that. It's just saying that we want to give people more transparent information.
Yeah, and that's something that's been well accepted. If you look at the way that tobacco is packaged, for example, if you're going to buy a pack of cigarettes, you're going to be seeing right there in pretty clear terms nowadays what some of the potential health effects are. That's been relatively obscure in terms of the health impacts of alcohol. Again, we've had pretty limited communication knowledge around those long-term health impacts and the relatively low or moderate levels of alcohol drinking that can cause them.
Is the next step to limit advertising of alcohol or where alcohol can be advertised?
Yeah, there's, a few different things that we could look at. The way that alcohol is advertised, to whom it's advertised, and how, the kind of venues that you can see alcohol advertising. There's a lot of discussions for policymakers around that. And again, that's something that we have a bit of a template and history of with tobacco advertising over time. And one of the biggest drivers of alcohol consumption, especially problem consumption, can be just the availability of alcohol. So the number of stores, bars, or other alcohol serving outlets that are available, and the hours of those can be very important. Right. So one thing that policymakers can look at is of course, there's a convenience factor that people will describe in terms of being able to have a store in their neighborhood or that sort of thing. But at a certain point, the balance does come into play, at which we want to think of, are there potential harms to the availability, and what's the right balance between those things?
Mm-hmm. Well, Doctor, it's incredible that the uproar that has been created and the conversations that are happening. But I think ultimately it's a good thing that we are discussing this. And so I appreciate your time tonight to shed some of the science on these headlines that we're seeing in the news right now. So thank you so much for your time.
Glad to talk with you about it. Thanks, Mo.
Absolutely. Folks, that was Vancouver Coastal Medical Health Officer Dr. Michael Schwandt. Now, after some business, since we've looked at alcohol consumption from a public health perspective, let's talk about it from a social perspective. And I think I have just the friend for that chat. Tea Time with Tamara Taggart is up next.